Spot On is sponsored by the Wellbeing Project here at Boston University. This project is a new campus-wide initiative to support students' health and wellness during their time at the university. Log on to bu.edu to learn more about the Wellbeing Project. You are listening to Spot On, a health and wellness podcast that breaks through the latest media headlines to provide you with accurate and usable information that is, well, spot on to meet your needs. I am your host, Dr. Joan Salge Blake, a nutrition professor at Boston University and the author of the college textbook called Nutrition and You, which is used in colleges across the United States and abroad. So how do you like today's episode? Sex in the dark. No, it's not going to be about having sex in a dark room, but rather how to be enlightened about STDs, better known as sexually transmitted diseases. This episode is going to tell you everything you need to know. So let's go to the streets and ask folks how informed they are about safer sex.
I think I've been pretty well educated about safer sex just because my high school was really into it. It's not really impacted my life a lot yet, but
I feel pretty informed and I'm STD free, so whatever I'm doing is working. Having grown up in a liberal state to now going to school in a liberal state, I definitely feel like I have the knowledge I would need to make safe decisions.
What I know is basically what previous partners that I've had have told me, or other women in my life have told me.
I went to Catholic school, so our sex ed was that there is no danger as long as sex only happens within the confines of a monogamous marriage.
I know a lot from my school district because I didn't grow up in a super evangelical area. So they actually taught us how to put the condom on. And I think I found out a lot of it from TV shows, from the Discover page on Instagram.
Okay, so how did we come up with an idea for this episode of Spot On? Well, I read something. I read that there are about 20 million new cases of STDs, sexually transmitted diseases, each year in the United States. That one didn't really do anything for me. I kind of knew that, but this is what blew me away. About half of these infections are in people between the ages of 15 and 24. That was okay, I'm living under a rock, so I really don't even know anything about this, and shame on me. So I said, that's it, we're going to do an episode on this, and I brought in the sexual transmitted disease guru. I guess I don't know if you want to be called that, Dr. Sophie Godley, but she knows everything, and she's a clinical assistant professor and director of undergraduate education at Boston University School of Public Health, and she's worked in the field of public health since the early 1990s, and her area of expertise includes adolescent sexual health. See, I have it in writing,
yep,
Dr. Sophie,
that's true.
Okay? And translating public health research to practitioners and to the public. And I want to tell you something. That is not easy to translate it to the public. So I brought her in because I got to find out more about this because I really don't know. Okay? Welcome to Spot On, Dr. Sophie.
Well, thank you so much. I'm very happy to be here.
I am shocked.
It is shocking.
Okay. Oh, you're just doing that to be nice.
No, it is shocking. Everyone should be shocked.
Right. I knew of it, but I just never thought 15 years of age at 20. My mouth is open. It's rare that I'm speechless, but I
Yes.
actually got a moment there. Why are younger people at a greater risk for these sexually transmitted diseases known as STDs?
Well, unfortunately, we've had sexually transmitted infections, sexually transmitted diseases have been a problem for young people for many years. So this isn't new. Okay. But because we're so quiet and ashamed and afraid of talking about sexual health, we often don't hear about sexual health news the way that we might hear about news about diet or exercise or other kinds of really common health issues that all of us encounter. Well, all of us have sexual health as well. The issue is that it's much less discussed. And that actually feeds and helps STDs continue to spread because we're afraid to ask questions. We're afraid to talk to each other about risks and protection. And in some cases, unfortunately, we find that adolescents, and I would say particularly adolescent boys, are really reluctant to get help. And they're reluctant to talk to their healthcare provider about what's going on for them and whether or not they even need to be tested for sexually transmitted infections.
Where do you think this should be taught? Or where should they get this information?
So I'm one of those radical people that believes that we should teach about body parts, all body parts, starting in kindergarten. We should be teaching about sex, sexual health, right from the first moment that we teach about things like eating and blowing your nose and covering your cough and things like that. So we don't want to teach, obviously, we don't want to teach the same things to kindergartners that we're teaching to high school kids, but it also doesn't make any sense to wait until 9th or 10th grade. And then, what I hear from my students is then you have the gym teacher awkwardly stand up for half an hour and tell you not to do it.
So in other words, let's do it earlier and do it right.
Yeah, and start conversations so that it's not this big, scary, oh my God, now we're going to talk about sex, like, everyone get afraid and nervous. Like, if we were more accustomed and more familiar with talking about sex and talking about our bodies, I think we would actually have a lot fewer problems, not just with STDs, but with a whole range of sexual health issues that we're struggling with, not just on college campuses, but across the country.
You know what I love? What you just said? You keep on calling it sexual health. And when you put the health after the word sexual, it takes on a whole different connotation to me, rather than sexual practices.
From a biological perspective, the way that this works, and I try really hard to use language that emphasizes neutrality and isn't about, vulnerable or kind of we make women out to be flowers and we act like penises are weapons. And to me, that's crazy. We have bodies, we have body parts. Some people are born with penises. Some people are born with vulvas and vaginas, and that's just how it works. Some body parts are definitely more susceptible to sexually transmitted infections than others. In the context of heterosexual sex, a vagina or vulva is always going to be more vulnerable than a penis. And that's just reality. It's not that there's anything wrong with having a vulva or that girls are somehow weak or anything like that. It's just the basic biology of how those, or the anatomy, I should say, of how those structures work. So what that means is that unfortunately, girls, women, people with vulvas are going to bear a higher burden of sexually transmitted infections, just like, of course, they bear the risk and then are shouldered with the responsibility for pregnancy. What we need to be doing more than anything is really encouraging communication so that girls and women feel like they have every right and are empowered to say what they want, what they don't want, what feels good, what doesn't feel good, and to be able to protect themselves and keep themselves healthy.
Do you think that girls get more sit down on the sofa, let me talk to you from their parents than boys?
Yeah, I do. And actually, it's not just my thinking. There's data that backs that up, that because of menstruation, we often end up doing puberty education for girls, but we don't warn boys and we don't have open and honest conversation with boys about what's going to happen to you when you go through puberty. So I've heard pediatricians tell me these like heartbreaking stories about boys showing up in their offices who've started to experience nocturnal emissions, what we know as wet dreams, and they think they're peeing the bed.
Yeah.
They think there's something wrong with them, and there's absolutely nothing wrong with them. That's a normal part of development. It's a normal part of your body adjusting and growing and changing with hormones. And if we could reassure boys that what they're going through is normal, and we can also predict it. We can say, like, okay, so this is going to happen first, and then this might happen, and, you're going to have these feelings, and it's going to go like this, and what are you going to do about it? Like, none of this is a secret.
Right.
And we shouldn't be leaving kids to figure all this out on the internet.
Oh, gosh, no. Oh, gosh,
Right.
no.
But in the absence of the good, solid information in the context of a loving relationship, hopefully in their family, or ideally, I should say, in their family, that's where kids turn.
Right. That's right. And the biggest role models are the parents for everything in life, whether
That's right.
it's eating
Yeah.
or talking about this or how they view
That's
the
right.
world. So the parents, again, have this enormous responsibility, but I'm not sure that they understand or are comfortable enough to discuss it.
That's right.
And or know how to do it at an early enough age.
That's
is what
right.
They're trying to say that. So, for young adults, what's the best way to prevent STDs?
So what we want to think about is how we are protecting ourselves and keeping our body as healthy as possible. And that includes our sexual health. And so what I hope for college students, for young people, is that just like you think about, okay, I need to get my vaccines up to date, I need to, go and get my annual physical, I need to do this or that, I need to get my medication refilled. You also want to be thinking about, if you're sexually active, that you want to regularly get tested for STDs, or at least have a conversation with your provider and let your provider guide you. Because in some cases, it may or may not be necessary. We also don't want people over-testing and getting, really paranoid about their situation. So having protected sex with partners is a really great way to keep yourself healthy. Making sure that if you are having sex with multiple partners, that you have space in between, so that you're not in a concurrent relationship with people, and therefore increasing the possibility that you might be spreading diseases. So we need to have conversations. Partners need to have conversations with each other about, okay, when a lot of couples will start out using condoms, and then as they become more intimate or as they become more established, I often hear people say one of their goals is that they hope they don't have to use condoms. Mm-hmm. And obviously, if that's a choice that you and your partner want to make, we would encourage you to just be absolutely certain that you're having as much open and honest conversation with each other as you can, because people, unfortunately, don't always tell the truth, and we don't always know. So we want to make sure that we're having good conversations, testing regularly, and when in doubt, using protection.
It's interesting because I think growing up, protection was drilled in, don't get pregnant.
Right.
That was like, don't get pregnant.
Exactly.
And that was it. But none of this. So in other words, the person could, say the female could be on the pill.
Yeah.
But that doesn't, if you're in a sexual relationship, that doesn't, that's not prevention.
It doesn't protect you.
Right. So it's almost like you have to do a double layer here.
Right. And the best birth control options, which I would, again, really recommend that people talk to their providers about, which probably, to be honest, is probably not the pill. There's some other really good long-acting reversible contraceptions that we would encourage young people to look at and talk to their provider about. So the IUD is amazing, really good protection. Mm-hmm. I like to say, even though this horrifies my students, it's not your grandmother's IUD. This is the new, 20,000 IUD that's been updated and is very effective, and it's much smaller, it's much safer, but it does not protect against STDs.
Right. Are you saying that better than the pill because once it's already inserted? In other words, you don't have to worry about, oops, I forgot to take the pill?
Yeah, I actually think the pill is pretty much the very worst option for young people.
Kidding. Okay, now you shocked me
I really
again.
do.
And why is that?
Because you have to take it at in some cases, at the same time every day. So fertility is a little mean if you think about it. So your fertility is the highest typically for young people, at least certainly for young people enrolled in colleges and universities. Your fertility is the highest right at the time that you are the least prepared to become pregnant and start a family. Mm-hmm. So that's the time you need the most vigilance around your birth control, right?
That's so interesting.
And it changes as over the course of our lives. If you ask someone in their 30s who's happily partnered and wants to start a family, how are you doing with your birth control? They may say, well, if I get pregnant, that's okay, right? And
right.
it's not that big of a deal. But when you're 18, 19, it's a big deal.
Sure.
And you want to make sure that what you're using is really effective.
That is so interesting and so spot on because you're like fertile myrtle.
Exactly.
Early on in the game here.
That's right.
When you just said when you don't want to get pregnant,
Right.
that's really, really important.
Are you having trouble sleeping, focusing, or relaxing? If the answer is yes, then the TM Softs White Noise Sleep Sounds podcast has got you covered. This hour-long podcast is made to help you get rid of distractions, reduce stress, relax, and most importantly, get better sleep. You can listen to sounds of nature, white noise, relaxing music, and much, much more. You can check out the TM Softs White Noise Sleep Sounds podcast on Spotify or wherever you listen to your favorite podcast.
So what are the most common STDs?
Interestingly enough, there's a lot of discussion these days about HPV and a lot of discussion about the connection between human papillomavirus and cervical cancer. And the reason that we're often talking about HPV is because we now have a vaccine for it. And it's a very effective vaccine, and it's really remarkable. It's just changed the landscape. We can essentially eliminate cervical cancer.
Wow.
If we strongly get the word out about HPV vaccine. We haven't done the best job with encouraging people to get vaccinated. And in some cases, people get a little bit of misinformation about vaccines or they're hesitant about vaccines anyways. But I will absolutely go on record saying I think it is a remarkable vaccine. It is cancer prevention, and young people should absolutely take advantage of it.
Both males and females.
That's right. Yeah, so when we first released the vaccine, it was just indicated for girls. More recent research has come out that said it is absolutely indicated for boys as well.
I'm just trying, if you get an STD, like, what are the symptoms? Like, when could you get alarmed?
This is the thing about the other common ones as well as HPV are chlamydia and gonorrhea. It's no one's fault, but there are not symptoms. It's very likely to be asymptomatic. And so the only way to know that you have chlamydia or gonorrhea in most cases is to get screened. And when you get screened, then you can almost immediately start treatment for the two most common, chlamydia and gonorrhea, in this age group, the most common. And you can clear up that infection really quickly. The time when we see side effects or symptoms that people notice is when you've had multiple chronic infections with chlamydia, and that develops into pelvic inflammatory disease. And that's when we get really concerned because pelvic inflammatory disease starts to impact people's fertility. So the infection can come from the vulva through the cervix into the uterus and then into the fallopian tubes. Fallopian tubes are tiny. You know, from your sex ed class in 7th grade, you might think that they're like highways. They're not. They're tiny. They're literally the width of 2 human hairs.
Oh, boy.
And so any kinks or disruption in those tubes can cause pain and can cause ectopic pregnancies and other kinds of complications. So we really want people in their adolescence and as young adults to be thinking about keeping themselves healthy, not just for today, but because of the impact that's going to have when they do eventually want to start a family, or even if they don't want to become parents, just in order to live a happy, healthy life further on down the road.
My eyes are bugging out here. So, so if they are sexually active, I know you said often, but like how often should they be tested, and where can they go? Is it only the healthcare provider? Where can they go to get?
Yeah,
tested?
that's a great question. So unfortunately, there's not kind of one simple answer. So what I would say is that for some groups where we know STDs are in higher concentrations, so you might not be having lots and lots of partners, but you're more likely to have a partner who already has an STD. You're more likely to be exposed. If you happen to be in one of those groups, we're going to recommend that every 6 months you get tested for STDs.
Okay, good.
And for HIV, that's going to be Can be a saliva test. It can be a blood test. We have rapid testing now where we can get your results back to you very quickly. For chlamydia and gonorrhea, people get really scared that this is going to be some horrific testing nightmare. And in fact, it's pee in a cup. It's pretty simple. So again, for certain groups, we would say every 6 months. For sexually active folks who haven't had a scare or an exposure or something that they're worried about, I would say at your annual visit to your healthcare provider, that's a great time to ask to get screened.
You know, a lot of young adults do not go annually to
I know.
the healthcare provider.
I know.
Can you, and you know, what I see popping up now are all these Medi-clinics, these clinics on college campuses. There is a student health services. Can I go to like a Medi-clinic to get this done or the student health services?
So you can definitely go to student health, absolutely. And that one of the things you're going to want to do is have a quick conversation with them about whether or not that's going to become part of your medical record, and will that get back to your parents, or is that protected information? So that's going to be different depending on how old you are and what kind of insurance you have, et cetera. So I don't want to give a universal warning about that, but it's just something worth having a conversation with your provider about. You certainly can go to a Medi-clinic. You can go to, there's drop-in clinics for sexually transmitted infection testing. My preference, frankly, is that, certainly if I'm going to receive health information, I like to have a relationship with the person who's giving me that information. That helps me feel like, okay, we're going to work on this together. I'm going to have somebody support me as we solve whatever condition it is or situation we're working on. So I think those Medi-clinics are a little bit tough because it's kind of anonymous. Mm-hmm. But I also understand that sometimes that's exactly what people want.
Where can they go to get the help that they really need?
So if you're diagnosed with one of the sort of more simple infections like chlamydia or gonorrhea, you'll be probably sent home with a prescription for one of the antibiotics that we use typically to treat those infections. If it's a more serious diagnosis, like an HIV diagnosis, our goal would be to immediately get you into care. If you happen to be in the Boston area, that would be most likely be one of our remarkable HIV care centers at our local hospitals or at Fenway Community Health. The other thing, though, that I should mention is if you've had an unexpected exposure, so if you were not expecting to have sex and did, and it was unprotected and you're concerned, one of the things that you can do is you can access something called post-exposure prophylaxis. This is called PEP. And post-exposure prophylaxis is available. It's a high dose of antiretrovirals that you take immediately after your exposure, and it can greatly reduce the chances that you become seropositive, that you would test positive for HIV. We don't have that for chlamydia and gonorrhea, but for HIV we do. And so that's something that's available, and people can access that online. You can look up online where you can get PEP. It's the same medication we give victims of sexual assault or people who've been exposed by a needle stick or a healthcare accident, something like that.
We will find that, and we will put that up on the Spot On's Facebook page. In fact, we're going to load it up. We're going to have more resources than we're going to have length of this episode, because I want to make sure everything gets out there, because, we all need to be educated on no matter what age. Mm-hmm. And I know you're looking at me, but I am older than 30, okay? You didn't have to laugh. That was really not nice, but whatever. Okay, so we talked about heterosexual, but what about not heterosexual people having sex?
So as we have become, I think, as a society, better at taking care of people who identify as members of the LGBTQI community, I think we have done a pretty good job of reassuring people that when you go into a health center and you present with your situation and you talk about who you are, that you're going to be met with care and kindness. Mm-hmm. So I think one of the things that we can do to reduce sexually transmitted infections is make sure that people feel welcome getting health care. And if people feel welcome getting health care, then they're going to go in, they're going to talk to their providers, they're going to get the support that they need. I think the other thing about this part of the topic is to remember, it's hard for me to get through a even a short part of my day without talking about Schitt's Creek, so I have to bring it up. But, shows like Schitt's Creek or other stuff that we see in social media, like sexuality is not, it's not set in stone. It's not cemented. It changes. Mm-hmm. What you call yourself doesn't necessarily align every minute of the day with what you actually do. Mm-hmm. And so I think it's dangerous and unhelpful when we say things like, well, lesbians aren't at risk, blah, 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 because that's absurd. There's nothing about that, calling yourself a lesbian, identifying as a lesbian doesn't protect you against STDs, right? It's really about what behaviors you're engaging in. And so as we've become a more open and honest society that's more welcoming, my hope is that people can go to their doctor and say, this is what I've been up to. With these body parts, in this circumstance, here's what I need.
I like that. You know why? It's very scientific. Look,
yeah,
this is what I'm
exactly.
doing. These are the body parts.
Right.
What's my risk? Is there any time in a relationship where you don't have to do condoms?
Oh, if I could answer that question with 100% certainty, I could retire, I think. I'm going to say a guarded yes, right? So I think it's a mistake, and I think adults are guilty of this, where we look at young people and we say, well, you could never be in a serious relationship, or you could never have a relationship where you trust each other. That's crazy. Mm-hmm. Age is not what's important, mm-hmm. right? So there are adults that cheat on each other, mm-hmm. and there are young people who have stable, loving, some of the most beautiful relationships I've seen. Right? The key is that you are able to communicate. And if you can talk about hard things like money.
That's hard. In my household, really that's very hard.
Yeah.
Okay, yeah.
Yeah. If you can talk about things that are hard and you can get through it and you can be honest with each other, then absolutely. Right. But if you haven't tested your relationship in that way, if things have just been going great and you haven't really had a moment where, somebody made a mistake or did something, untoward or whatever it was, then I would be more reluctant. But if you've gone through a hard time, it's almost like if you've had a stress test, then I think, yeah, absolutely. I think there's great reasons to have trust and love for one another and commitment. And commitment looks different for different people. I'm not trying to say everybody has to get heterosexually married and every relationship has to look the same. Of course not. But I also think that, there's part of me, maybe it's the mom part of me, that does want to warn people, right, that people sometimes do not do what we expect them to do. And some of the worst work I ever had to do when I was working in HIV and AIDS were people who'd become infected by people who they loved and trusted and never dreamed they would be exposed. Knowledge is power, and secrecy fuels epidemics.
Yes.
And shame fuels epidemics. Yes. And we get better connection with one another as human beings, and we are safer and healthier when we can be honest. Right. And I think if there's one thing that I wish we could sort of teach people at these young adults is that, now's your time to be figuring out who are you going to be in a relationship? How do you want to be as a sexual human being? And can you be an honest and clear person about what you want and what you don't want and how to stay healthy and safe?
So I'm hoping that this information, as a parent, I'm better now. My children are no longer children, but I think everybody can learn from this. And I think you're right. I think just having a conversation, and for no matter what age, male or female, to say, look, I want to have this conversation with you.
That's right.
All right? And listen, Right. I want to talk and sit down and talk and have this conversation. And I think if more people were saying, I'm doing this with my partner, everybody would think this is normal.
We don't have to stab around in the dark and wonder, does that work? Mm-hmm. We know it works.
Right.
Look at Europe. Yeah. Europe has dramatically lower rates of sexually transmitted infections than we do. And here's the key about that, Joan. They have similar rates of sexual activity. So how does that work?
Right. Hello.
They're
doing a lot of talking. And was it you think because the stigma early on wasn't there, and they started much earlier?
So it's stigma. We know this. We have some good research on this. It's about less stigma. People tend to have longer relationships with one person rather than jumping around, which of course increases your risk. And they have better communication with their parents. Carrying condoms doesn't mean that you are, promiscuous or any of those other shame-filled words. It just means you're smart.
Right.
It's like carrying an umbrella because it might rain. You're not making it rain. This is a Nicholas Kristof reference. He put in a column once in the New York Times. Carrying an umbrella does not make it rain. It's about being prepared and taking care of yourself. And that's the same. We should be thinking the same way about things like condoms. And that's what they do in Denmark. It's what they do in Germany and Spain, across Europe.
So I think the take-home message here is that we need to all move to Europe.
I would be very supportive of that.
Okay. I'm going to Italy. I don't know about you.
I'm going to the Netherlands.
With that, I want to thank Dr. Sophie Godley to come on and explain this to all of us. And boy, have we grown. My knowledge, my head is busting right now, and I am so excited that I know this information. So, Dr. Sophie, thank you for being on Spot On.
Absolutely, my pleasure. Thank you.
Spot On is sponsored by the Wellbeing Project here at Boston University. This project is a new campus-wide initiative to support students' health and wellness during their time at the university. Log on to bu.edu to learn more about the Wellbeing Project. Spot On is supported by the Boston University Sargent College's Master of Science degree in Nutrition program. Log on to bu.edu to learn more about this fabulous nutrition graduate program. Thank you for listening to Spot On. If you enjoyed this episode, don't forget to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. This way you'll get every new episode every week. And by the way, leave us a nice review. And can you also like us on our Spot On Facebook page and suggest topics for future episodes? Please follow me on Twitter and Instagram at Joan Salge Blake. And oh, by the way, can you send this episode to 5 of your friends? Do I ask a lot of you?